Harris.
And I'm Elisa Bokeen, and we are two brown chicks changing the face of therapy on both sides of the couch. Yes.
And I am in the middle.
Yes, you are. You're on this side of the couch. In the middle of the couch. Yes, I love it.
So today we are going to be talking about psychiatry with Dr. Napoleon Higgins.
Wow.
Yes.
We appreciate you joining us today. We don't get to see many brown and black psychiatrists, so
I appreciate the opportunity.
Yeah,
Thank you guys
we're
so
so
much.
thankful to have you here.
yes. So if you can, tell our audience a little bit about you, who do you serve?
Well, my name is Dr. Napoleon Higgins, and I'm a child, adolescent, as well as adult psychiatrist. I say I'll see anyone who comes in at least once. You may not want to come back, or I may not want you back, but
Right.
I'll see you at least one time. All right. So I treat all ages, all diagnoses. I do specialize more in child and adolescent. Treat a lot of depression, bipolar, ADHD, anxiety disorders. But if I can't help you, I probably know where to send you to get the help you need. I'm down in the Clear Lake area, from Houston, born and raised for the most part, or around these parts. Shout out to the family out in Brazoria County, out in Higgins, Texas. Sunnyside, South Park, High Park, Missouri City. Graduated from Willow Ridge High School, went to Prairie View, PV, you know.
All right.
Yeah. I did go to Meharry for Meharry Medical College. But other than that, I've lived my entire life below I-10.
Okay.
Yeah, so south side of Houston is where I'm from and where I'm at.
I feel like that's a song.
Yeah, a song called Southside.
Yep.
Lil Kiki.
You said.
Yeah, I go and get it in for you.
That is the song.
I love it.
Yes.
So tell us about your journey into psychiatry and what made you choose that for your career path.
You know, my mother says, God rest her soul, that if the family would have had heart problems, I would have been a cardiologist.
No.
Yeah, so a lot of mental health in the family, recognizing that I thought some people just behave and act differently.
Right.
I didn't know that was something quite abnormal.
Right.
Just that some people heard voices, some people may go off and pop off on people for no obvious reason. So that was just something I saw and I grew up around. My grandmother was schizophrenic, but she was a very functional individual, very loving individual. And so when I went to medical school, I would notice that my classmates would shy away from people who acted differently or behaved differently or shied away from psychiatry.
Okay.
And to me, I was drawn in.
Right.
I loved helping people who have mental health issues. So that's kind of where I would say I probably started with. Also, when I was coming out of high school, my mother was working on her master's in counseling at Texas Southern University.
Oh, wow.
Much love to TSU.
Yeah.
I went to PV though. But you know, I think that has some influence with my career choice as well. Kind of thought about family medicine for a little bit, but you know, once I did my psychiatry rotation in medical school, I knew I loved it, and that's what I wanted to do.
I love that.
That's awesome.
And can you tell people, because I get this question a lot when people call or in session, is what's the difference between a psychiatrist, a psychologist, a therapist, a counselor? Can you tell people that maybe are not really sure?
Well, you have to look at training and background. You know, so as a psychiatrist, I am a medical doctor.
Right.
You know, I did pre-med, biology pre-med at Prairie View. I went to medical school, did 4 years of medicine, which basically, you know, I'm a doctor. I'm a medical doctor.
Right.
So from the medical doctor, I specialize in behavior and abnormal behavior and mental health issues. So from there, you know, so essentially I do medication management. Also, I have to look at all the medical issues that could be going on that affect your mental health issues.
Right.
Versus with your master's level or your PhD level, those are disciplines that are a bit different. Even though we see a lot of the same people.
Right.
Sure.
So I get that confusion all the time where a person comes in to see me and they're looking for therapy, or they want psychological testing.
Right.
No, that's not what I'm trained to do. I'm trained to do the medical side of it, as well as I'm trained to do therapy. But then you may need to see a psychologist or a therapist for the therapy section of it, or you may need IQ testing or other type of testing that is more done by masters and PhD individuals.
Right.
Great. That's
So I think that's great. I think it's talk therapy is counselor therapist, psychologists are more assessments, and then you're more on the medication side. It's like easiest way, but obviously there is some overlap where
Right.
psychiatrists and psychologists also could do talk therapy and
Right.
that type of thing as well.
Yes, there is a fair amount of overlap.
Yeah.
Right.
Yeah. Awesome. So why do you think we see such a shortage of brown and black psychiatrists?
Well, I think a lot of that is that you see a shortage of blacks going into medical school, or even those of us choosing, STEM type, educational patterns.
Right.
So if you don't go to medical school, then you cannot become a medical doctor, which then means you cannot become a psychiatrist. If you look at the issue right now is that approximately 13% of the population is African American, but only somewhere between 2 to 4% are going to be psychiatrists.
Right.
And some would say 2%, and some people even question if it's that high.
Right.
So it's very difficult to get in to see one of us. And then if you look at the number of black males going into medical school, it has plummeted.
Wow.
I know one year it was around 300 total who got admitted to medical school from around the country totally.
Oh wow. Okay.
Which means that then limits even further the opportunity for those to even become a psychiatrist.
Right.
So there are, educational concerns. So often we're not in the right classes coming out of middle school, coming out of high school to prepare you for a STEM type of career. Kids can be sometimes geared or steered away from the higher level type mathematics and sciences that typically you're going to see a medical doctor going to have.
Right.
So I think it starts very early into the educational system. In the third grade, they start putting you in tracks on where they expect you to go.
Right.
All right. So this track is prison. This track is higher education.
Right.
And then you have those in the middle.
Right.
It's then difficult once you get into middle school. If you get past middle school and you haven't started being tracked to that other direction for higher education, it's very hard to catch up.
Yeah.
So the issue starts very young, but then also having adequate mentors. It's not a lot of blacks in mental health or blacks in psychiatry, so therefore it's then hard to find a mentor to give you the right and correct information as you're trying to move forward with that career.
And just to model it for you.
Yes,
right? To be able to see somebody model it for you.
For it to be tangible.
Yeah, exactly.
Yeah. You have to have that representation and be able to see if you even know that that's an option for you.
Exactly.
Awesome. So you and your colleagues wrote a book, Mind Matters, a resource guide for black communities. What was the inspiration? Like, what made you guys say we need to get this?
We have the book here.
And he has a copy.
I don't know. Bam!
Wait,
there you right there. So this book right here, Mind Matters, a resource guide to psychiatry for black communities. 10 black psychiatrists, we all got together right here to write this book. And we're basically colleagues and friends. I had the idea of the book, and then Dr. Timothy Benson had the idea of, hey, we were talking about this. He's like, maybe we should do this as a group. And because one, you can have more information, more ideas, different thoughts, different input. And so often we go at things alone, but things can be done a lot better for a group. And with that, part of that also of using a group is because only one person can do so much.
Right.
Yeah.
We're all very busy.
Yeah.
We're all professionals. We all work like dogs, to be honest with you, for the most part. And so it's very hard to get a project out by yourself. But by sharing the load, basically things, a book is a lot easier to write if you've got 10 people writing.
Yes.
So that's kind of how we came to the idea of, using the group to do so. So we're colleagues and friends. We've been knowing each other 10, 15 plus years. So, in trying to get the group together, we definitely want to go with people who can get along.
Right.
That's a lot of people. I was going to say, when you said, I'm thinking about like the group projects in school where you're like, oh my goodness.
well, you have someone that waiting on someone to do their part.
Right.
Like, yo, man,
Which one were you?
Yeah. Well, being lead on it, I wanted to always be the first one done.
Okay.
The first one. I didn't want anybody waiting on me.
Okay.
Now, sometimes they said, well, let me say it differently. If you're the lead on it, sometimes they're waiting on you to move so they can do their part, which would normally make me to be first. Make somebody else last to get it done. But sometimes they're like, "Yo, we're waiting on you to do your what's the next part."
Sure.
But also, when you have a group of colleagues who are very smart and intelligent, who can do it on their own as well, you can trust their the decision making. And it actually pushes you to do better because you don't want to be the one lacking. Especially when you have a group and a team of very talented individuals
Yeah,
who
yeah,
can get it done.
right.
Yes.
That's awesome.
I love that.
That's really awesome.
I love that, and I love that image of all of you there together, and really speaking again to being that representation,
Right.
Mhm,
like
mhm.
really modeling it for students that are there and they're contemplating what direction to go, and so I love that.
Yeah, that's very awesome.
Yeah, and also we're around the country, so
Mhm.
we're kind of spread out around the country, and you know, and it's good to see group cohesion. You've
Yeah.
got 10 black people
Yeah.
all sitting in one place working on the project, smiling. Now I won't say it's a perfect project; it's not a utopia.
Of course.
You know, we do a fair amount of falling out.
Yeah.
You know, but we fall out like family. You just kind of move past that and you move forward.
And sometimes that pushes you to make a better project because we
Right.
have difference of opinions. So let's,
I can guarantee you, if I'd done this book on my own, it would not be where it is right
Sure,
now. It would
sure.
not be where it is right now.
Sure.
What are some of your favorite parts about the book?
Well, my favorite part about the book is really what it was all about in the first place, which is connection to the community.
Mm-hmm.
That's what this book is about. We wanted to make sure that we were able to connect mental health to the black community because we are the least likely of all groups to receive mental health treatment.
Right.
And sadly, you look at the numbers right now, and black adolescents are seeing psychiatrists and mental health persons less now than they had been. And what's scary about that is black suicide attempts by black teens and the completed suicides have
Right.
gone up by over 200%
Oh, wow.
in the last 15 years.
Right.
There's a direct correlation between the ability to access mental health services and the decreasing in rates of suicide in the area.
Sure.
So right now we're seeing psychiatrists and mental health persons less,
Yeah.
and suicide is going up.
Right.
You know, and
How we get better. That's why we're not going to see it. Yeah.
exactly, and that's just a sad thing to see, especially when there's help out there,
Right.
Yeah.
and many of these things we do not have to suffer from.
Yes. Yes.
Yeah. That makes sense, and that's part of, I guess, even trying to just get it in front of people,
Right.
so they can know that this is an option, even if
Mhm.
you've never thought of it or heard of it before. It is an option.
It is an option. When it comes to things like depression, bipolar disorder, anxiety, essentially there are enough mental health professionals out there, there's enough therapists out there, there's enough treatment out there to where essentially 80-90% of the time you don't have to be depressed.
Right.
Or, you know, mood disorders essentially do not have to command your life.
Mm.
You can grow and be productive and be fruitful and
Right.
take care of your home and your family
Right.
and work and all those things if you go out and seek the treatment
Right.
that is needed. But so
Right.
often we suffer in silence, we don't go in, we have all the stigma, and part of this book is trying to decrease that. You know, we try to decrease the fear in that we tell people in this book about mental health in a lay type language.
Right.
Mhm.
Right.
And that's what's important.
So important.
And that's what this book is about,
Mhm.
so that we go over the major mental health diagnosis. We even talk about medication management, non-medication management. We talk about the need to do therapy. You know, and the fact is this, when it comes to psychiatrists, if I give you a pill, it is a very low chance that you taking this pill right here is going to change what all is going on with
Right.
you. It is a piece of the other things that may need to occur.
Right.
You may not need this piece, and you may need to do the other, or you may need to do the other may not work as well, and you may need this piece.
Right.
But it's a series of
Right.
events that has occurred. And the other thing, that one of my favorite chapters in this book is in the appendix on how does a psychiatric interview go.
That's
So
great.
that we talk about what should you bring to the doctor's office, your insurance card, your list of medications, what medical issues you have going on. It's good to have a list of the medications you take, the doctor that prescribes it,
Right,
all right,
right.
and what is it for.
Right.
all right? That helps out. We talk about what type of questions will be asked,
Yeah.
what type of medical issues that we have to, medical conditions we have to consider. And the point is just to demystify what's going to
Right.
happen in the room.
Right.
Because so often that fear
Right.
keeps us away.
Yeah.
Because people suffer in silence, and if you're getting treatment and help and therapy, people don't talk about it.
Right.
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 Realizing that you have more psychiatrists than OBGYNs.
Mm.
Now, obviously, half the population goes to see the OBGYN, and they'll say they're going to see the OBGYN.
Right.
Right.
But half the population doesn't talk
Well,
about
say
I'm
they're
going
going
to
to
see
see
the
a psychiatrist.
psychiatrist.
Yes.
That's
Yes.
true.
And
Yes.
not to mention, when it comes to psychiatry and all of mental health, it's so many more of us than really when you look at all of general medicine.
Yeah.
So the most common the largest medical specialty is psychiatry.
Wow, I didn't
I
know
did
that.
not know that.
Wow.
So behind internal medicine, family medicine, and pediatrics, the most common doctors are psychiatrists.
Yeah.
Mm.
Well, and I think sometimes people are more okay with going to their general practitioner to tell them, oh, I might be
Right.
depressed, or I might have. There is that fear of what it means to go see a psychiatrist.
Right.
Yes, and and that's a tragedy. In
Yes.
that you're realizing that your general practitioner
Mm-hmm.
is going to treat more mental health than the psychiatrist does
Yeah.
because there's more of them.
Yeah.
And that's the first stop.
Mhm.
So essentially, if you have diabetes, well, your general practitioner is going to go over how to control your
Right.
your blood sugars without medication, and then they'll start you on another medication, maybe metformin. And there's a whole series of events that goes by before they start insulin or other levels of care. And then if that's not working, then they send you to the endocrinologist.
Mm.
Well, so often with us, we'll start with the primary care doc, but then we'll fear the next step.
Right.
And now you need to see a specialist.
Right.
And when you're not seeing, not taking it to the next step, then the other things start to unfold.
Right.
So
Yeah.
far as the issues of suicidal thinking, and
Right.
psychosis may develop, or the need to now access services in a emergency room
Yeah.
because now we've attempted suicide.
Mhm.
Or so often with us, especially our black men and black women as a growing population, we tend to many times we don't access services until we're now locked up.
Mm.
Now you got put in jail behind some sort of behavior,
That was
and now we're
calculated.
criminalizing
Mhm.
Yes.
your mental health.
Mental health.
Yep.
Yes.
And now you've got a whole other set of issues
Yep.
that may affect you mentally.
Yeah.
Yeah.
So frustrating, and that's why I'm so glad that we're having these conversations, and that there is representation, because when you were saying that about how much the increase has been in attempted suicide, Mike, what do you attribute that to?
Well, typically when you see a suicide attempt or a suicidal behavior, the most common issue is that you feel hopeless.
Yeah.
Mhm.
Hopelessness has set in a lot in our communities,
Yeah.
and that goes back well before we were around. So
Yeah.
you've got 400 years of slavery, you've got Jim Crow. We still have to vote every 50 years to allow black people to vote. Not nobody else, just black people. In the United States, we have to vote every 50 years to allow black people to go vote. And then you look at voter suppression,
Right.
or you look at the issues where you have two men who've been accused of crimes that occurred 20, 30 years ago. One goes to the Supreme Court and the other one goes to prison.
Right.
With the same type
Right.
of comments,
Right.
the same type of
Mhm.
behaviors.
Mhm.
That, not saying that neither one or not should have been punished,
Right.
but the question is why the disparity?
Right.
And we continue to see this inside of our communities.
Yeah.
So that hopelessness sets in for our kids. The fact of not being able to see your future.
Yeah.
How are you doing educational wise? The stress that these kids go under now.
Right.
I don't remember this at all. In high school.
Right. Definitely.
Right.
The need to perform in school. I know
Mhm.
kids who believe that if they don't have a certain score on the SAT or get accepted to this particular school, they cannot get an education or get a job.
Right.
Like lies or a lot
Right.
of lies out there.
Right.
A lot of flossing and all that kind of
Yeah.
stuff on Instagram about how great your life is and all this kind of stuff. And and I think so that social media pressure to
Oh,
be
yeah.
this person
Right.
or that person, and if you're not doing this or that,
Right.
then you don't have it going on.
Right.
Bullying, I think this is so much more difficult now.
Oh yeah, you can't block it out because it's there.
It's
there.
everywhere.
Yeah.
It's not just at school. It's on your phone.
Right.
Yeah. Yeah.
The world has contact with your child, and your child has contact with the world.
That's right.
Outside of the south side of Houston, I
You
know
didn't
what.
know, right?
Yeah.
Yeah.
I had some folk in the 4-4 or something like
Right.
that. You know what I'm saying? But Trinity Gardens, baby. I
Yeah.
didn't. But outside of my circle,
Right.
I wasn't exposed
Right.
to the rest of the world.
Right.
I saw my circle was cultivating.
Yeah.
I had there was a lot of love in the hood.
Yeah.
Church in the hood, store in the hood, school in the hood,
Yeah.
family in the hood, and it was a lot of love there.
Mhm.
Right.
So my circle of what I knew was small, but it was a loving thing. Now, don't get me wrong, there were problems,
Right.
in those areas, but I did not have to be bombarded by
Right.
what the world had to say about
Nonstop.
how I should be.
Yeah.
Yeah.
So
Definitely.
true.
So what do you think are the biggest misconceptions that the Black community has about psychiatry?
Biggest misconceptions is that, there's so many. One is that psychiatrists only prescribe medications. That's all they do.
That's it.
We're not thinking about anything else. We just want to give you a pill.
We're just gonna give you a pill. Yeah.
I would say that fear of the medical model, because of all the history that we've had, Tuskegee experiment, disparities in care, and a lot of these things are very real that you have to be concerned about.
Right.
I would say those two, and then just a lack of understanding of what's going on, the lack of education regarding mental health, the importance of your mental health, and that we're against those other things that you may be trying to do.
Right.
So often the community will think that we're against you going, paying attention to your spiritual side, or that we're against you as an individual, and that we're trying to change you, or make you weird, or make you addicted, or something like that. Those are a lot of the fears and misconceptions you see in the Black community, and you see in other communities as well.
Sure.
But realizing that it's important to get looked at, but also it's important to make sure that we communicate good, correct information.
Right.
And that's what the movement about the book is about. Trying to communicate, destigmatize, take out all the weird words and language. And then also the issue of not having enough people who look like us who understand our culture. Realizing that your culture does determine outcomes. Whether or not you'll take the medication has a lot to do with the suggestion of who actually recommended it. Oddly enough, as a Black therapist, if you recommend something, a Black person is more likely to follow the recommendation than if they heard it from a white therapist. And that's an issue of a lack of connection and trust. So that directly impacts culture, directly impacts, and it can be difficult, especially with psychiatry, to find somebody who's of your culture. Like with Black people, we often associate our mental health with our spirituality and our religion. And like I used to do residency in Galveston. I'd be up all night in the hospital, and I'd play the bass at church. So I'd be up all night, show up to church in the morning, and see the patient that I just discharged last night, looking like a totally different person, haircut, clean, got their suit on, because now they want to hear a word from God. And so often when you look at some of our other colleagues, some who are non-Black, they're less likely to understand spirituality, even though they should be trained and should be able to understand, because you're trained to do that. But some may not understand that connection. And how important that is to the overall mental health of our people.
I really appreciate what you said, and I think that's something that we haven't talked about a lot, but that concern of the way that minorities, especially Black people, are treated when it comes to the medical model in the past, and making sure you're acknowledging that that's a valid concern. As opposed to like, that's not a concern you should be worried about, just do what you need to do for your mental health or whatever. Like, that's a very valid concern to have, because that truly was not that long ago that those things are happening. And
not trusting the system is a very valid fear.
Exactly.
It's a very valid fear.
Let us down plenty of times before. So.
If you fully trust the system,
you
may need to come see me.
Exactly.
There should be a level of skepticism.
If there's not a level of skepticism, then you may be having some other issues.
You have to expect that people are going to have these doubts, these concerns, and that they're valid and that they're real. And like you said, be able to integrate all parts of them in the treatment.
Yes.
So when would someone know they need to see a psychiatrist?
There are several. One is if you basically the emergencies is more going to be towards our way. If you're suicidal or homicidal, having violent behavior. The second I would say is a deterioration in functioning. So essentially, you're so far in the throes of your mental health, you're not able to work, you're not able to take care of yourself or your family, especially if you lose the ability to control or take care of your daily living issues. You're not bathing, you're not eating, you're not sleeping, those things. And then third reason I would say you would need to come in and see a psychiatrist, if there's a medical issue going on, and there's also an issue with your mental health, where that intersects at.
Can you give an example?
So essentially, I'll have somebody in like a metabolic crisis, blood sugar's high, cholesterol is high, they're having issues with chest pains and high blood pressure, and you're depressed. Realizing you add the depression on, there is at least a third chance to have, 1/3 to have chance that you're going to have a bad outcome. All right, because if you affect you mentally, it affects you physically.
Right.
So the mental stress many times can be causing the physical stress on your body.
Absolutely.
So the fact is that I may get a referral from your endocrinologist, like I cannot get this I can't get this blood sugar under control until we get the mental health under control.
Right.
Also realizing that, you know, in metabolic crisis, you can develop issues of depression. So there are certain illnesses that depression is very high with.
Sure.
Yeah.
Like if your thyroid is off, your blood sugar is off. Sometimes, you know, you may be having rapid weight loss and depression or weight gain. So as a medical physician, I have to run the medical part of what's going on with you, and realizing that you take a bull by the horns. So essentially, if all those things are going on, we may need to pay attention to what's going on with your mind.
And it's such, I'm so glad you're saying this, because again, if we're going to sound like a broken record,
Right.
but the importance of this holistic approach to healing, that it's all parts, you know, we can't leave out the physical also, right? And I love what you said. You may need a pill, but that's not going to be where it stops, right? Like there's still going to be, the pill may be what you need in order to get to your therapy sessions, right? And there's going to be a certain amount of work that you have to do as part of your healing process as well.
Yeah.
You've got to do that part. You know, I recently saw somebody who was, you know, in the throes of a mental health issue, and they were like, well, actually, they came to see me because they wanted psychological testing for their child. The child is psychotic and hearing voices, and they can't communicate, not taken care of. They can't bathe. They're having difficulty eating. They can't be left alone by themselves, and they can't even communicate.
Right.
So you're in the throes of your mental health issue, and you can't even talk. Well, I'm like, well, before you can get psychological testing done, this child is not going to be able to do therapy or psychological testing until we get some other things under control. So realizing that it takes a combination of those. But, you know, I tell people, if your spouse is cheating on you, your oldest child just got put in prison for 10 years, your youngest child just hit the principal, you just lost your job, and you got impacted by Harvey, I can feed Prozac all day, and I can guarantee you, you need social services, you need legal services, you need therapy, not to mention if you had childhood trauma on top of that. I mean, all of that is working together, realizing that at that point, those other things have to be taken care of before even the medication can work. You know, so all of that has to go in together and helping an individual.
And I think we really have to give ourselves permission that we are worthy of healing. Right? Like that you don't have to, like you said, suffer in silence and suffer alone. And that narrative of how strong we are, like we are worthy of giving ourselves the opportunity to heal. In all of these different ways.
Well, so often what I've found in our community is that when we're struggling with mental health, we feel like it's our burden to bear. You know, like God is working with me or punishing me. Like God is working with me to make me more spiritual, more connected to what? Depression? You know, or the lack of hope, the hopelessness? Or the other side of it is, you know, I'm being punished for past sins. And I'm like, you know, my God is a good God. He does not want me to feel bad, feel sad, or feel down. And the other side of that is many times we can give the devil too much credit. Like the devil is working on me. I'm like, well, you know what? Maybe, you know, therapy needs to work on that. Maybe you need a professional now. So often I think that just that misunderstanding and then some of the, I would say some of the adaptive behaviors that we've had from that misunderstanding can actually be negative towards us.
And these messages that were fed to us also, why? These abstract messages, and I'm not by any means, you know, discounting anybody's religious, spiritual beliefs, but sometimes we have to get to the point where we have to look at where did these messages really come from. So why are we being fed these messages that it is noble to suffer, that it's noble, you know, to just take on more and take on more and take on more? Like, who does that benefit?
You know, I would say, you know, when one thing I've learned about the Bible is, one, I'm happy I read it myself.
Mm.
All right. And so with reading it myself, and I did this 15 years ago, I became a bigger believer, but it gave me a better understanding of the word. So I would say that it's helpful. The word is helpful, and church is helpful. And it, realize church is like one big group therapy. All right. And normally they're going over, oddly enough, the Bible is principles of psychology all throughout the word. So really, to me, when I go to church, I'm like, okay, this looks like one big therapy session. All right. Plus you got a lot of sick people there. All right. So the thing about church is very helpful for your overall mental health. But I think some of these misconceptions that we can have goes long ways back. Can go a long ways back to 400 years ago for controlling people.
Absolutely.
And to me, until you have that personal relationship with God, I would question, you've got to have your personal relationship, but to me your personal relationship is grown through understanding. And then that way you can dispel mentally some of what people are talking about. Realizing that many times we get caught up in cliches versus actually reading the word for ourselves, understanding that God wants you to be happy. God does not want you to be punished. God does talk about mental health in the Bible. It's all throughout the Bible. It's not in this one section, this one verse. Mental health is throughout the entire word, and that Jesus said he came as a physician to help the sick and the ill. So if you're doing well and you're all right, he didn't come here for you. Realizing that all of us have issues. Life happens. Life happens to everyone. And we need some help. And sometimes that's medication. Sometimes that's therapy. Sometimes that's social work, sometimes that's legal, and sometimes that's spiritual. Sometimes you need to hear a good word. And that's when I would go to church and you would hear, person just got out of the throes of hospital or just got out of jail, and they're going there to hear a word from God. And they want something to speak to them that day. And that's why it's important to make sure that we take our churches seriously. Because that's generally where we get the majority of our mental health care.
We need to feed all parts of us. We need to feed all parts of us. And we can have all those. We can go to church, and we can go to therapy, and we can go see our psychiatrist. We can do all those things.
Diet and nutrition as well. Another one you got to throw in there.
Yes.
Oh my goodness. How you feel, what you ate for lunch will determine how you feel within 30 minutes, the rest of the day, and the next day. So often we forget about, did you read about Cheerios? How to have some kind of poison in it?
What? Cheerios?
Yeah.
The honey nut
The high healthy Cheerios?
The high healthy Cheerios. It came out on as an article today. I forget who posted it. But like one of the major magazines, major news, so I'm like, poison? And that was, and it was another thing as well. But anyway, that I got.
It's all combined.
It's all combined. The diet, nutrition, also you look at, so often we're feeding our kids processed foods. If you're shopping for groceries at the dollar store, that may be a problem. There may be a problem. And all that contributes to the overall mental health of the individual too.
Right. So what is your favorite resource? Of course your book, but also are there any other resources or podcast, books, anything that you think just will help people that are watching?
I would say, well, man, when I thought about major resources, one, I thought about my book first.
Of course.
Yeah.
Pick it up. Mind Matters.
What? There it is. Mind Matters. This is a very good resource. This is the resource I think about every time. Every day. But when it comes to Black people and their thinking, the book that stands out most to me is The Miseducation of the Negro by Carter G. Woodson.
Yeah, read that
that is a book that I think just kind of explains the background of where we're from to look at where we're at. And if you read the book, it looks like he wrote it yesterday with this in-depth understanding. Shout out to Woodson Middle School, Jaguars. Anyway, much love, South Acre, Sunnyside. I would say when it comes to mental health books, to me the problem is the dearth of information. So often you'll have lay individuals writing books that can miss the point, even though there are a lot of good ones there. I have my list of good mental health books. I have them all in my office, and I can't think of any specific right now. But the other side of it is that for those of us who are professionals, too often we write our books for other professionals. So we're trying to impress our highly trained, licensed friends on how much more we know about mental health than they do. So this book was not for those who are who already know. This was for the people itself
that need the information.
So it's really, the book is written in question and answer format based on the questions that individuals have for us, and we have to answer it back as if we were talking to Big Mama. Big Mama was the avatar, and so the thought was, if Big Mama can't understand that word or that sentence, then it has to be taken out and redone. We rewrote every line of this book about 4 times so that it reads like butter. So even going through the psychoform and dopamine and serotonin and norepinephrine and acetylcholine and all those medical terms, we wrote them out so that people could understand what was going on. So trying to fill that gap. Another thing I would say is that when it comes to psychiatrists, I know 6 psychiatrists who wrote books on mental health this year that came out in the last 6 months. So right now there's this resurgence of, we need to understand what's going on within our community. And so, we're just trying to plug in another space in the gap to help our people.
Awesome.
Love it.
Thank you. What makes you a dope psychiatrist?
Oh man, I'm completely off the chain.
I wrote a book.
And actually, this is my second one.
Okay.
So you never know. By the spring, by the summer, you may say 3rd. I don't know.
Okay.
But no, what I would say makes me a dope psychiatrist is that I would have to say my family. My family, my wife, and Angelica, Dr. Angelica Higgins. Shout out to Kelsey Sebo. Thanks for sending the checks. My daughter Nadia, my mom who's passed, my dad, my sisters, one has passed. My sister, hopefully you made it to work today and hopefully got over your medical issue going on. And I would say
all kinds of shout outs.
My Bay Point staff, all my staff who work with me at the office. Extended family, I think that's what makes me dope. All the experiences. I think I'm well trained. All the educators, got to show them love, and just the thirst for knowledge and love for the community.
I love that. That is dope.
I love that.
Yeah.
That's one of the best answers I've heard.
Well, no shade to anybody else.
No shade to anybody else. No.
Well, I'm probably doper than that. That's what it is. But it's cool though.
But what I was going to say was, because I love that you are really recognizing the people who help make you dope, right? Like your family and the people that support you at work. Like, I love that.
Yeah, all my friends, family, my boys, everybody.
I love that.
Yeah. That's awesome. What overall makes therapy, getting help for your mental health in whatever capacity it is, what makes that dope?
What makes that dope is that you're addressing your issues, realizing that we all have something going on.
Right.
And either you're running to something or running from something. And too often when we're running from, we're not paying attention to where we're going. So it's so important to make sure that you take care of your mental health. And that's why therapy is dope. Even when it comes to medications, therapy is still dope. I would say probably at least 1/3 to half, maybe 3/4. I'm going to recommend some sort of therapy to go on, because there are other things that need to be corrected. Realizing that something probably drove you to the chair sitting across from you. And we need to figure out the pathway back to understand where it all started and how do we clear up and move forward from here, so that you have some better direction in your life.
Love it. Awesome. Well, we're going to try and get you a practice open out here in the city.
We need you to travel to Houston.
I know plenty of other dope psychiatrists who are close to me.
He's like,
I'm out in Clear Lake. I've been there since I walked out of residency. Much love to all the folk down that way on southeast side of Houston.
Love it.
Okay. So how do people find you, find your practice, follow you on social media?
You can find me at Napoleon Higgins everywhere on all my social media. Bay Point Behavioral Health Service down in Friendswood. Just put in Napoleon Friendswood Psychiatry and you should be able to find me. Napoleon spelled the original way.
Nothing fancy about it.
Nothing fancy about it. Higgins. Napoleon Higgins, and you can find me.
Awesome. We'll tag all of that, including how you can get his book, or their book. It's a group effort. And so make sure that you check out the show notes for this episode. Thanks everybody for watching. Thank you for being here, of course.
Yeah, this was awesome.
This is a good conversation. We really appreciate you. Make sure that you follow Melanin and Mental Health across social media at Melanin and Mental Health, Melanin Health on Twitter. In next month, we have Dr. Manuel.
Yes.
She's like, what are we talking about?
Yes.
He is doing a webinar for
Next
Melanin and Mental
webinar.
Health. It's already on the Melanin Mental Health events. Browning your counseling. So if you want to work with Latinx or Chicano or Chicana,
Latinx community,
Okay.
why wouldn't you want to work with us, right?
so if that's you really need to be a part of this. He talks about making sure that you have made your practice culturally appropriate for those communities. So check it out. And I think that's it. I think we finally have time down a little bit for the end of the year.
We still got a lot of stuff coming up.
Oh,
So
yeah,
we're gonna keep you on post.
KOG.
Yes, KOG Speaks next Monday. Go to our Instagram. We've got the information there about the screening of diversity. Oh my goodness.
It's a movie screening that we're
yes,
going to be
it's gonna be
speaking
so
on the
good.
panel.
We're going to be on the panel. We'll have all the information in the show notes
Yes.
as well. But don't forget to visit the website, the directory. People will ask us, do y'all have a directory? We do. We have a directory of therapists from across the country. So if you're looking for a dope therapist, go on there, type in your city. If you don't see somebody there, send us a message and write something up, calling the people in your city to get registered.
Call them out. Yeah.
Yeah.
So make sure you check that out. And of course, the shop. We have
Yeah.
lots of new shirts there.
Like
This is an old one.
It's an old
But
one.
we have
got
lots
some
of new shirts there. The latest one is I'm a therapist, but not your therapist. A little bit of shade.
new- Right. Well, you know therapists, right? As therapists,
Yeah.
sometimes you're around your family members or friends, and they're like, "Well, you're a therapist, aren't you?"
Yeah.
Yes.
Mm.
And I'm not your therapist.
So check it out.
You can wear it to the next family function.
Yes,
in the
Thanksgiving
holidays.
is coming up. Wear the shirt to Thanksgiving. That'd be fun. And tell us what happens when you wear it.
Yes.
All right. That's all, guys. Thanks for joining us, and we'll talk to you next week.
Bye.